Do you ever wonder if your joint pains are rheumatoid arthritis or psoriatic arthritis? Hello, my name is Dr. Siddharth Tambar, specialist in rheumatology and regenerative medicine, and today I am breaking down the key differences between these two diagnoses and what you need to know in just a few minutes. Let's get started. Rheumatoid arthritis is an autoimmune disease where your immune system attacks your joints, causing pain, swelling, and stiffness. It usually begins in the smaller joints like your fingers and wrists, affecting both sides of the body equally. Psoriatic arthritis, on the other hand, is also an autoimmune condition, but it's linked to psoriasis, a skin condition. Psoriatic arthritis can cause joint inflammation, but also targets your tendons and skin with red scaly patches. There are some key differences between RA and psoriatic arthritis. RA often affects smaller joints symmetrically, meaning both sides of the body, like the wrists and the fingers. Psoriatic arthritis, on the other hand, has a much more varied presentation. In some cases, it can present like rheumatoid arthritis, but it can also present as just one joint that's affected or inflamed, or the spine itself may be inflamed. You may also see what's called sausage digits, where you have swelling in an entire finger or toe due to not only the joint being swollen, but also the tendons and ligaments around that joint as well. In psoriatic arthritis, joint pain often comes with visible skin changes from psoriasis as well. That can look like red rashes or even pitting in the nails. The presence of psoriasis is classic for this condition. When it comes to bone damage, which you typically see with more advanced and chronic disease, psoriatic arthritis can cause both bone destruction and new bone formation, while rheumatoid arthritis primarily erodes the bones, leading to classic differences on X-ray seen many years after diagnosis. There are some similarities between these two conditions as well. They're both autoimmune conditions, which means that your immune system, which is meant to protect you from bacteria and viruses, in the case of an autoimmune condition, gets triggered to accidentally start attacking your own body. You also have inflammation in both of these conditions. Chronic inflammation causes joint pain and damage in both of these diagnoses. Inflammatory arthritis symptoms are also very prominent in both of these conditions. That includes prominent stiffness first thing in the morning, pains that are worse with rest and in the morning and better with activity typically. Treatment, while each condition requires a tailored approach, both can be treated with medications such as disease-modifying treatments and biologic treatments, which reduce inflammation and prevent joint damage. There is some crossover in the treatments that we utilize between RA and psoriatic arthritis, but there are also some that are very specific for each one of these conditions. And as such, making a very firm diagnosis is important. So how do you diagnose these two different conditions? In rheumatoid arthritis, there's a very classic presentation and very consistent amongst patients where you see pain and swelling in the small joints of the hands, wrists, and feet. In many of these patients, blood tests for antibodies such as the rheumatoid factor and anti-CCP antibodies can be positive and help to make this diagnosis. Keep in mind that at initial diagnosis, 50% of RA patients will be antibody negative, and long-term 25% will be negative. And then, of course, imaging tests can also show classic RA damage findings, and ultrasound or MRI can show active inflammation in the classic joints that are affected. Psoriatic arthritis, on the other hand, diagnosis is often based on physical symptoms like skin and nail changes from psoriasis, and then either examination and plus imaging findings such as ultrasound that show inflammation in the joints, tendons, and ligaments. Blood tests are frequently done in psoriatic arthritis to rule out other conditions like rheumatoid arthritis, but there is no one specific blood test that helps to diagnose psoriatic arthritis. Left untreated, there are long-term potential effects for both rheumatoid arthritis and psoriatic arthritis. RA can cause severe joint deformities and may also affect organs like the heart and lungs if untreated. Psoriatic arthritis can also damage tendons, ligaments, and joints, and may also lead to metabolic issues like diabetes or heart disease. Both of these diagnoses, if untreated and if there's chronic inflammation, can lead to a higher risk of heart disease and strokes long term. So when should you see a doctor? If you experience joint pains, swelling, or morning stiffness lasting for more than an hour, or if you notice skin changes like scaly red patches, it's important to see a specialist. Early diagnosis and treatment here can help to prevent long-term damage. So in closing, both rheumatoid arthritis and psoriatic arthritis are serious conditions, but with the right diagnosis and the right treatment, you can manage your symptoms, protect your joints from getting damaged, and put these conditions into remission. If you think you might have one of these conditions or want to learn more, contact us at Chicago Arthritis. And if you found this helpful, give us a like and subscribe. Thank you for watching and live well. Bye-bye.